Well, and just to jump, sorry to cut you off, but this is the argument with soy, right? This is like the big hitter. We haven't even mentioned soy, and I feel like it's my fault because I'm thinking about all these plastics and stuff, but soy activates both receptors. And so some people, they genetically make more alpha or more beta or whatever, they can kind of get away with soy. And so you do these studies. And number one, the soy studies are a problem because you're researching people that are exposed to phthalates and BPA and whatever. And their body is just chock full of all these estrogens. And then you throw a little bit of soy in there for 6 weeks and you really think you're going to get breast cancer. Of course not. You're not going to increase anything if your system is already washed out in these estrogens. So that's the first thing. But the second thing is, it's complicated because some people do have higher risk of breast cancer with soy. Some people don't. It's because some people have more estrogen alpha receptors and some people don't. Just genetically, people are different. And so that's the real problem with soy, is that it's a risk. Every scientist agrees that it acts like estrogen. I mean, there's no debate about that. The debate is, is it a good or bad trigger, right? Is it a good estrogen or bad? This is the isoflavones in soy, the estrogens in soy. The debate tends to go in the direction of whether it's good or bad, like whether postmenopausal women should have it or not as a therapy or something. And I say no, because it activates both receptors. It's too risky. You don't want to be activating alpha. You're much better off with actual estrogen, actual progesterone to balance that off. But again, there's a lot of money there, so there's a lot of like muddying the waters with some of these. All it takes is one study that muddies the water, and then everybody gets caught up in saying, well, no, there's this one study that shows that it's actually really good for you, and there's 20 other ones that show it's bad.